So sleep-related anxiety is different from other kinds of anxiety because it's specifically anxiety about sleep, which happens in a cycle, where if you're anxious about something, there's so many things involved. You avoid it, you take steps to mitigate it, it causes a lot of stress. But with sleep, what's different is when you have sleep-related anxiety, your anxiety is about sleep. Then what happens is your anxiety about sleep becomes the very activation that makes it so you can't sleep, which then supports the prediction that sleep is going to be a stressful and anxious thing, which means next time you start going to sleep, you're going to be more stressed and anxious about your sleep because you're going to predict that you're not going to be able to sleep. So sleep-related anxiety is a little different on its own because it can perpetuate itself by directly making it more difficult to sleep. It's actually quite common where people, when they first experience insomnia symptoms, especially once they start having those insomnia symptoms beginning to feel a little out of control, that's really where they start worrying and they start panicking about not being able to sleep. And then that's where the cascade really starts. So I see sleep-related anxiety very, very often in practice. So when you look at anxiety disorders, there are a number of symptoms that you would look for. And it's the same with sleep-related anxiety, but specifically you're looking at anxiety around sleep itself. Fear of not falling asleep, fear of the consequences of not falling asleep, and fear about not being in control of being able to sleep. It's really about the target of the anxiety. And it just so happens that when that happens, it perpetuates itself by becoming a self-fulfilling prophecy, with that anxiety leading to more wakefulness, leading to more anxiety. Well, physiologically, there's lots of things that can be happening. There's a whole literature on stress and how stress impacts hormone systems, brain systems, reward systems. And really, the only thing that's particularly different here is you have a conditioning response, where the act of falling asleep becomes physiologically paired with inability to sleep. So you can often see patients who are, a good sign of this is that you have patients who are maybe nodding off on the couch before going into bed, but then when they start getting into bed, they wake right up because they get what's called a conditioned arousal, where the act of trying to fall asleep or being in the bed or being in the bedroom itself creates that cascade of psychophysiologic reactions to the environment. Well, especially for new onset insomnia, what it does is it sets the stage for turning acute insomnia into chronic insomnia. Because the biggest difference between insomnia that's short-term that resolves on its own and insomnia that persists for months, years, and sometimes even decades is the concept of conditioned arousal, where the act of falling asleep itself creates activation and stress, because sleep becomes predictably stressful. And when sleep becomes predictably stressful, that predictable stress becomes the very activation that keeps you awake. And that's why it's really important to focus on this issue of sleep-related anxiety. A lot of people are worried about their sleep, but they don't realize that the worry itself is what's creating their problem. There are some great strategies for reducing sleep-related anxiety. Those include a number of cognitive therapy techniques, some behavioral therapy techniques, and also some acceptance and commitment therapy and mindfulness techniques to help people recognize the difference between sleep effort and sleep-related stress, which is actually making their problem worse, and actual problems that they can work around and actually reduce that stress. So the combination of those things can be very effective. It's important for the people to whom the patients go for help to recognize what it is that they're seeing. And if a patient goes to a primary care physician or other provider with an insomnia issue, and that provider doesn't know the current treatment guidelines and strategies for insomnia, maybe they should consult or collaborate with somebody who does, whether it's sleep medicine or especially behavioral sleep medicine, who's more into the insomnia piece. Sleep medicine physicians should remember that the behavioral non-pharmacological approaches to insomnia are recognized as first-line therapy and should be integrating some of that in there, especially when you have the sleep-related anxiety. And because with psychiatrists, sleep medicine, primary care, often they focus on that anxiety as arousal that they then try to medicate by blunting that arousal, thinking that will solve the problem. But actually it isn't. It's more the cognitions related, and that's why the behavioral and cognitive therapies work a little better. Some important practical tips. Number one, assess for it. Ask people about what their anxieties are around sleep and probe for whether they are experiencing sleep-related anxieties. Number two, focus on the difference between normal disturbances in sleep that are okay, that aren't going to dramatically impair functioning, and those that might need to be treated. Because sometimes people worry very much about their sleep in ways that are counterproductive. So besides that education, another really great tip to have for people with a lot of sleep-related anxiety is actually find alternative ways to channel some of that anxiety, whether it's something distracting in the evening or a relaxation exercise or something. But if you find that people are exerting a lot of effort around that, maybe actually working on reducing that effort is the way to go. One important thing I want to talk about sleep-related anxiety is that people who experience this, and sometimes the clinicians too, who don't have as much background in sleep, think that if anxiety is causing sleep problems, fixing the anxiety will fix the sleep problems. That doesn't really work for two reasons. Number one, that once the anxiety causes the sleep problems and you have that conditioned arousal, it perpetuates itself even with anxiety disorders treatment, and that's been shown in the literature for decades now. The other reason that that's not the case is that the way that insomnia develops is the anxiety might have been an initial trigger, but unless you're still in very much that acute phase, it's not what's keeping the insomnia going. People can habituate to these things, and often the anxiety leads to that effort, and by focusing on that anxiety and creating an unrealistic expectations of like removing all stress and anxiety, it just makes people feel more anxious because they have a bar that they can't cross. So what I would say is, remember that even if patients come in saying my anxiety is causing my sleep problem, blunting the anxiety isn't necessarily the most efficient way to get them past it.